Bismillahirrahmanirrahim. Assalamu alaikum, viewers and parents. Dr.S.M.Zafeer with you, and you are watching my YouTube channel. Today, I will share with you constipation in children and what to do. Childhood constipation is a global problem and is very common. In every 10 children, 3 are suffering from constipation. It is commonly seen in a child aged 1 to 5 years. The mother's perception is if her child is not having bowel movements or poop every day or at least every 2 days, he is having constipation. Mother should know that painful or hard poop, 2 or less poop per week, stool withholding, and presence of large fecal mass in the rectum is considered constipation. What are the risk factors which contributes to constipation? Male sex, poor sleep, obesity, low fiber diet, consumption of junk food, cause milk protein allergy, home and school related stresses, adverse life event including abuse, subjected to bullying, anxiety, depression, autism. Living in war-affected area, living in urban areas, hostile and aggressive family environment, these are the contributing factors leading to constipation. In 1992, that is 30 years ago, a study published about the 7 types of poop. Number 1, marbles type, that is hard and rock type. Number 2, caterpillar type. Number 3, hot dog type. Number 4, snake type. Number 5, amoebas type. Number 6, soft serve. And number 7, Jackson Pollock, that is the dribbling of stool, that means diarrhea. Now let's watch this mechanism of constipation in children. The risk factor is changes in routine, changes in diet, stressful event, postponing defecation, that means the child is very busy and he is not defecating, and too early toilet training. These are the risk factors which leads to constipation in children. Now, if the stool is stasis in the rectum for a long time, the fluid and the water will reabsorb and it will increase the size and consistency of stool. That means the stool or the poop becomes hard. When the poop is hard, the child will struggle to pass this stool and he will have pain. When he is having painful defecation, he is going to hold his stool, that is the voluntarily withholding. And when he is holding the stool, it will prolong the fecal stasis. That means the stool is again staying there and the fluid is reabsorbed. And in this way, the vicious cycle goes on and the child develops constipation. Your child is having constipation. Now, what to do? You must consult your doctor immediately if your child with constipation is having fever, vomiting, bloody stool, abdominal pain, and not gaining weight. Your doctor will give rectal enema if your child is having fecal impaction. Then he will prescribe oral laxative, that is stool softener. He will further advise about dietary modifications, gentle toilet training. Close follow-up for weeks or months is very important. Now, regarding dietary modifications, making diet and lifestyle changes can help treat and help prevent constipation. Now, regarding juices, prune juice, the most popular juice to relieve constipation is prune juice. You can give your child a prune also to eat. Apple juice. Apple juice may provide you with a very gentle laxative effect. Pear juice. Another great option is pear juice, which contains 4 times more sorbitol than apple juice. Banana is very good fruit to relieve constipations. You can give it to your child every day, one banana, and the banana should be a little hard, not full ripe. So this will give you a good quantity of fiber and your child will get relief from constipation. Fiber-rich foods with a higher water content such as raw carrots, apples with the skin and avocados are all great source of fiber to help get things moving and prevent constipation. Now, maintenance therapy. Gentle toilet training after 2 to 3 years of age. The toilet training should not be very harsh. It should be very comfortable and convincing to the child. Usually the parents go for very harsh toilet training from the age of 2 years, but this is not advisable. So gradual toilet training is recommended. Encourage your child to sit 10 minutes on the toilet 3 to 4 times a day after major meals initially. Viewers, this clip will explain to you the correct way how to sit for poop. The Continence Foundation of Australia recommends these 4 steps. Number 1, sitting with your knees higher than your hips. For this, you can use a footstool or other flat stable object if necessary, as shown in the picture. Number 2, lean forward and put your elbows on your knees. This arrow is indicating. Number 3, relax and bulge out your stomach. Number 4, straighten your spine. That means your backbone should be straight and you are little lean forwarding, that is 35 degree. So in this way you will have a very comfortable poop, and this is the anatomical position to sit on the commode or in the toilet seat to have a comfortable poop. Parents should maintain a stool diary in which mother can record bowel movements every day, fecal swelling, pain and discomfort, consistency of stool, laxative dose. Child should be rewarded if of not having swelling and sitting on the toilet regularly. So just encourage him also. Parents should note that follow-up is very important because the tendency of relapse of childhood constipation is very common. Monthly follow-up is recommended to adjust the dose of laxative. Laxative should be used for 3 months and gradually reduce the dose. What are the take-home message for the parents? Parents should focus on their child's diet, number 1. Number 2, gentle toilet training after 2 to 3 years. Number 3, avoid junk food and excessive milk and milk products. Number 4, child should sit on the toilet for 10 minutes, 3 to 4 times a day after each main meals initially. Number 5, increase intake of fruits and fluid. Number 6, reward your child if he is sitting on the toilet regularly and not soiling his trouser. Number 7, childhood constipation will not be cured in days or weeks. It takes couple of months. Number 8, to avoid relapse, regular follow-up is needed. Thank you very much. Stay blessed.